So it's the end of September, which means end of PCOS Awareness Month. But that doesn't mean advocacy stops, right? So we still have got to talk about this, because the more we talk, the more things change. The more things change, the more we feel, one, validated, seen, heard, and getting treatment we deserve. Okay, so I'm gonna talk to you for a moment from the patient side of things, and then my practitioners, I want you to also listen in, because this is how we help big time, okay? So obviously we can't diagnose, right? There's a lot of things that it could be outside of PCOS, but it's important to start getting documentation, starting to figure out what's going on with the body behind the scenes, okay? So on this side of things, and I'm gonna put this PDF on my website, thezapmaster.com, after I post this video. You can go over there and actually download this PDF and get to know your hirsute score, okay? So first things first, it's the score. Thank goodness I had that up right the very first time, because in filming this 2 times before that, that wasn't the case. It was like this. But, all right, this hirsute score helps you understand the severity of possible male pattern growth you have on the areas that are considered hirsute scores. Additionally, on here it'll tell you, once you hit a score of 8 or above, that usually indicates that it's like medically necessary for hair removal, okay? Now, not all insurance companies cover gender affirming care to begin with, right? And that is kind of our key in the door for getting PCOS covered. And there are things to think about. So if you have PCOS and it's not incredibly severe, right? Not every one of these looks like a full beard, full chest, full abdomen, right? Okay. You still may have to hit a sizable deductible. So you have to look at what your explanation of benefits are when it comes to this, especially since there is no FDA approved pathways for medical stuff with PCOS right now. We're trying to change it, but we have to work together on this. So this is step one. Okay, I want you to get to know the severity of this. Get to know your explanation of benefits. Get to see whether or not that kind of stuff is covered to begin with. And then there are ways for you to do reimbursement. So when you go to your electrologist, even if it's as simple as, okay, can you just provide me with a detailed receipt once a month of the transactions I've done here? Compile those and submit them to your insurance company with your filled out form. And then go to your doctor. Make sure your doctor is also notating this, because this, friends, once we have a medical history, we have a reason to have stuff done. Okay, so diagnosis, medical history, fill this bad boy out, bring it to your doctor, make sure your doctor's doing the same dang thing, and then get it on record that you are dealing with hirsutism. It is nothing to be ashamed of, even if society has said that we need to be hairless women. You need to do more for yourself, okay? Because they're not doing it. Secondary, I don't get paid to do these things. I only get paid to teach and do some hair removal. So at the end of the day, understand that this is a promotion because I love the book, okay? So these awesome individuals here created the PCOS workbook, okay? The reason I like this, it is literally, well, as a teacher, yes, I do like to do a little bit of extra work on stuff, but it helps you fill out what's going on behind the scenes. That's huge. Get this thing online. I'll drop on the same place that the hirsute score is gonna be. I'm gonna drop a link to this bad boy, okay? And it's important to start there, okay? Additionally, if you have questions about like upcoming labs, about the guidelines, those are gonna be on the same section, because there's gonna be a little PCOS segment. I was really thinking about this whole month, and I was like, you know what? If not me, then who in the electrology world? So, boom, get this, fill it out, make it your, like, I don't know, whatever, like your most important book in your life is, okay? Bring this to your doctor. Give them homework. Make them see how this has impacted your life. Additionally, I want you to get in the know. Now, you need to understand that when it comes to PCOS, okay, and I'm literally going to pull this off so I don't mess up any of my details. I need you to understand that PCOS has comorbidities, which when we think, okay, hair sucks, but let's understand what that usually tells us. Excess androgen production tells us other things as well, okay? So PCOS patients are between 1 in 10 to 1 in 5 worldwide. So 21% is actually like the number that they're going with right now. 21% worldwide have PCOS. Okay, it's lifelong. It does not just happen when you are of like reproductive age. Literally my least favorite thing that people keep talking about. Oh, it goes away once your hormones shift. Nah, friend, it just means that your symptoms shift. All right, so get to know and get your doctor to understand that as well. It's lifelong. Okay, there's no cure for it, but there's great treatment that you can help alleviate some of the symptoms, and there's lifestyle stuff that you could do to change it. All right. However, that lifestyle stuff, okay, this is the other part. It's more than weight loss. Okay, so it's usually the first answer we get from our doctor. Oh, have you tried losing weight? And docs, I know that there are a lot of people out there that don't follow like your guidance as medical practitioners, but they've been gaslit for so long that you need to understand why. Okay, so we're tired of being told just to lose weight. We need actionable items because we have been. Like, that's the thing. It's like your PCOS patient has tried every diet out there. Your PCOS patient is most likely in the gym hitting that thing all the time, right? You just get discouraged and you go through bouts of that not happening. But that's not because you're not doing it. You are, they are. Please elevate their voices and understand that, okay, if you have already tried diet and exercise, what pathways can we do medicinally, even off label, because there's no FDA approved medications, okay? What can we do? All right. You also need to understand that PCOS is not just gynecological. Okay. So it's not just here. Okay. It is reproductive, metabolic, it's hormonal, it is multi-system impacting. There is a neurological component to it. A lot of your PCOS patients are neurodiverse and have never once been given an opportunity to actually even venture down that because it wasn't for women, and we never had the opportunity to actually go through pathways like our assigned at male birth counterparts, okay? It wasn't stuff that we got to do. So take steps in that pathway. If your person that's coming into you is closer to menopause than they are to making babies, okay? Understand that when that shift happens, we feel like crud and we are just coping, okay? Patients, understand that if you feel like crud, advocate for yourself to stop feeling like crud. Do not take no for an answer. Keep going in there and asking and elevating your voice so they understand that they don't have an option other than to hear you out and try to find a path so you can feel better overall. I do want you guys to understand that there are some things in here that you need to know on top of this, okay? And this is more along the lines of heart health, because women's heart health is not necessarily taken as much attention on in women's health in general. Women's heart health is not really focused on, which is why we're just starting to hear about like the differences in women's heart attacks versus men's heart attacks, okay? But PCOS patients have 7 times higher risk of a heart attack, okay? And we don't even know what to look for usually. So teach your patients what to look for, okay? They have a 4 times greater risk of a stroke. They have higher risk of developing high blood pressure, lipid disorders, coronary artery disease, and up to 40% of those patients diagnosed between 30 and 45 may have already developed CAD. So you need to understand that. They can develop coronary artery disease as early as their 20s. Stop telling us, let's just wait and see. We're gonna dive in deeper, okay? Make sure your insurance company knows that you're having to do all of this stuff off label, and that's unacceptable. You pay them a premium for a reason, okay? So we're good with that. Researchers have found that women with PCOS generally have a thicker carotid artery, which creates a higher risk of developing heart disease. Friends, your heart needs the attention. Your body needs the attention. If you are concerned, you came to us because of hirsutism, right? You came to us like, this hair is not normal. You did your little test, and trust me, most electrologists are probably also looking at this as well when it comes to things. We'll fill that out for you. I'll put my name on that all day long. But I will tell you, walk in there with the confidence of, I have done my homework and I deserve better, okay? So yes, end of PCOS Awareness Month. We've gotten a little bit more aware, okay? advocate. In February, it's usually Women's Heart Health. We usually do a lot of stuff for advocacy during February as well. March is usually advocacy. There's usually an advocacy day in March. These are the steps that you can do to like work your way to it. If you ever have questions, you can always go to any of my links in my bio. If there is PCOS update information on there, you'll have it at your fingertips, because it's what I believe. There are a few other things that like need to be adjusted because the links are like no longer valid, which actually I'm in the process of doing right now, because I'm making sure that there are new links that are valid to put in there. But this is all about education. Educate yourself, educate providers, get researching, okay? And don't follow the fads, okay? There's a lot of people out there without evidence-based information spouting horrible things that take you away from shifting towards progress. Research, make sure that stuff has a scientific backing on it, and get to know your body. It's so important. So, September 30th, 2024, end of PCOS Awareness Month, but not the end of your advocacy. I'm shaking the table. Not the end of your advocacy. It is time for you to elevate your voice. Go teal, go big, okay? You got this. Peace, love, and hair removal. Bye, guys.